All right, we're diving deep into emergency medical kits today. It looks like from the sources, you're really aiming to be ready for anything. We've got a really cool mix for you. Guidelines from the WHO and the American Red Cross, advice from a medical supplies company, and even a podcast script on the topic.
Wow, it's really amazing how preparedness crosses so many boundaries.
Right. So let's unpack this a bit. What exactly is an emergency medical kit? Like beyond just a box of bandages, what's the core idea?
You know, one of the sources actually called it a lifeline. I really love that. It's that bridge, right, between sudden trouble and getting proper medical help. It's about having the tools to take action and potentially save a life, whether it's your own or someone else's.
Okay, yeah, that makes sense. So how do we actually build this lifeline? Where do we even start?
You can think of it in levels, like different tiers of preparedness. We can start with a super portable kit, minimal for everyday carry. Just 9 essential items, according to this podcast script we have. Emergency medical kits, your life-saving ally.
9 items. Okay, I can handle that. Give me the essentials.
Well, you've got your adhesive bandages, of course, antiseptic wipes, gauze pads, medical tape. You also want some tweezers, small scissors, disposable gloves, over-the-counter pain relievers, and don't forget a basic first aid manual.
Yeah, got to know what to do with the stuff.
Right.
Not just throwing random things in a bag.
Exactly. Having that knowledge to go with it is key.
So what about the next level up?
We call that a normal kit, suitable for most homes and for travel. Basically, you're adding 10 more items to cover a wider range of situations.
What kind of things? What makes this kit different?
This is where you get into things like elastic bandages, antibiotic ointment, hydrocortisone cream, instant cold packs. Also, oral rehydration salts. Those can be real lifesavers. And crucially, a good burn kit. You know, burns are surprisingly common and immediate treatment can really make all the difference.
Burn kit. Got it. Noted. What about if someone really wants to be ready for anything? Remote areas, natural disasters, you name it. What does that level look like?
That's what we'd call an extended kit. Now we're talking about things like a pulse oximeter to check oxygen levels, a blood pressure cuff and stethoscope, even an epinephrine autoinjector, you know, for those severe allergic reactions. This is getting serious.
Sounds pretty serious. I'm guessing this kind of kit requires some extra knowledge and training.
Yeah, absolutely. Don't want to have supplies you don't know how to use properly. For example, this kit also includes a tourniquet to control bleeding and maybe even sutures or wound closure strips. Definitely things that require proper training.
Okay, so we've got the foundation there. Minimal, normal, and extended kits. But you mentioned some pretty specialized kits earlier from the WHO. Those really caught my attention.
The WHO kits are fascinating. They've developed all these standardized kits for different health emergencies and outbreaks. It's about being able to respond, quickly and efficiently, especially in places where access to healthcare might be limited.
So places hit by disasters or conflict zones.
Uh,
I can see how having these pre-packed kits would be crucial in those situations.
Exactly. They even have specific kits for disease outbreaks. For instance, their cholera kit is designed to tackle, different stages and locations of an outbreak with different modules depending on the needs.
Wow, that's incredible. It seems like they have a kit for everything.
Yeah.
What other kinds of WHO kits are out there?
Well, there's the IEHK, or Interagency Emergency Health Kit. This one's designed to cover the essential health needs of 10,000 people for about 3 months. So think basic medicines, supplies, and equipment. But it's really important to remember it's for that initial response, not a long-term solution.
So like a first line of defense, filling in those immediate gaps. What's not included in the IEHK? Where are its limits?
It doesn't cover things like immunizations, nutritional programs, or managing those complex diseases like HIV/AIDS, TB, leprosy. It's really focused on those immediate life-saving interventions.
Interesting. So it's very targeted and specific. Makes sense. What else is in their arsenal of specialized kits?
They've also got the NCD kit, which stands for non-communicable diseases. This one is all about addressing those chronic conditions. Things like hypertension, heart disease, diabetes, respiratory illnesses, and even mental health conditions.
Wow. So they're not just focused on acute emergencies. They're thinking about long-term health needs too.
Yeah,
What about kids? Do they have kits specifically for children?
absolutely. The PDSAM kit is designed for kids aged 6 months to 14 years old. It focuses on treating those common childhood illnesses plus severe acute malnutrition, or SAM, which is a huge problem in many parts of the world.
That's heartbreaking, but it's good to know they're addressing it.
Yeah.
Are there other disease-specific kits like the one for cholera?
Oh, yeah. They have kits for measles outbreaks with modules for both severe and mild cases. And there's a pneumonia kit with a focus on treating children under 5, making sure they have the right antibiotics. It's really impressive how they've tailored these kits to specific needs.
Yeah, it really is. So they've got cholera, measles, and pneumonia covered. What other kinds of specialized kits do they have?
Well, there's one called the TESC. It stands for Trauma, Emergency, and Surgery Kit. It's essentially a portable operating room designed for, emergency surgical procedures.
Wow, that's intense. It sounds like something out of a war movie.
It's definitely designed for challenging situations. And then there's the CTT kit, which stands for Collection, Testing, and Transfusion Kit. It's all about ensuring safe blood transfusions, especially in areas where blood banks might not be readily available.
So crucial in emergencies. Blood transfusions can literally be life-saving. Are there any other kits we should know about?
One more, the SEK kit, which is a sample collection kit. It's used to collect and transport, various samples. Blood, spinal fluid, TB samples, you name it. It's like a detective kit for outbreaks, helping to identify the source and spread of diseases.
So it's not just about treating the sick, but also understanding the bigger picture of the outbreak. That's fascinating. It seems like the WHO has really thought of every possible scenario.
They really do have a comprehensive system. And the best part, they're constantly updating and refining these kits, based on the latest medical knowledge and the evolving needs on the ground.
That's amazing. It really does give you a sense of confidence knowing that these resources are out there ready to be deployed when needed.
It really does. Preparedness is about anticipating those needs and having the right tools available when the time comes.
Okay, so we've covered the basic kits and these incredible WHO kits for specific situations. But what about something, a little closer to home? What if you're just traveling? What should you keep in mind when packing a medical kit for a trip?
That's a great question. When you're traveling, especially if you're going somewhere remote or where access to pharmacies is limited, your medical kit becomes even more important. You can't just run to the store if you need something.
Exactly. So what should we be thinking about for a travel kit? Should we just pack one of those pre-made kits, or is there more to it?
Yeah. Well, a pre-made kit can be a good starting point, but you'll likely need to add some things depending on your destination and the types of activities you'll be doing. For instance, one of our sources, an article titled 33 First Aid Kit Supplies for Travel, really emphasizes having a more comprehensive set of supplies.
Okay, so what kinds of things are we talking about here? What makes a travel kit different from, say, a normal kit for home use?
You'll want to make sure you have plenty of adhesive tape, gauze pads, and bandages of all sizes. Plus, over-the-counter medications like antacids for indigestion, antidiarrheal medication, oral antihistamines like Benadryl, and pain relievers like ibuprofen or naproxen. A first aid book is always a good idea, too.
That makes it. You never know what kind of stomach bugs or allergies you might encounter when you're traveling. What about things that are specific to the environment? Like if you're going to be hiking in the mountains or spending time in a, tropical rainforest.
Absolutely. Depending on your destination, you might need things like insect repellent, sunscreen, moleskin for blisters, and even a way to, start a fire, matches, or a lighter. And don't forget about altitude sickness medication if you're going to be at high elevations.
I'm definitely taking notes here. It's amazing how many things you need to consider when you're traveling. What about communication? What if you need to contact someone in an emergency?
That's crucial. You should always have a phone card with plenty of minutes, some cash for emergencies, and a list of important phone numbers, written down just in case your phone dies or gets lost, and of course a phone charger. But remember that cell service isn't available everywhere.
That's so true. I rely on my phone for everything these days, but it's easy to forget that it might not be reliable in every situation. What else is essential for a well-rounded travel kit?
Let's see, you'll want a small flashlight, a multi-purpose tool like a Swiss Army knife, nasal spray, decongestant, antibiotic ointment, a pocket mask for CPR, safety pins, scissors, a thermometer, tweezers, and most importantly, a list of your medical history, medications, doctor's contact info, insurance information, and emergency contact persons. It seems like a lot, but it's better be safe than sorry.
Right. It's that peace of mind, knowing you're prepared for anything. But what about preparing for something like extreme weather? Say you're caught in a blizzard. What then?
Blizzards bring their own set of challenges, and being prepared can literally be the difference between life and death. Hypothermia is a serious risk, so having the right gear for, extreme cold is essential. We have a great source for this. What should be on your emergency medical supplies list?
Okay, so what's on that list? What do we absolutely need to survive a blizzard?
They recommend a multi-layered survival jacket and a sleeping bag designed to trap body heat. Emergency blankets, the kind professionals use, those are essential too. And of course, you'll need a good supply of any prescription medications, painkillers like ibuprofen, and anti-allergy medication.
So it sounds like staying warm is the top priority. What about other essentials? Food, water, those kinds of things.
You're right, food is important, but even more crucial is water. You can get dehydrated even in cold weather, so having plenty of water or those rehydration salts is key. And having a reliable source of light is vital too, especially if you're stuck somewhere without power.
This is really making me think about all the different ways we need to be prepared. We've talked a lot about what individuals can do, but what about the pros? What kind of equipment do professional emergency responders rely on?
Ah, that's another fascinating area. Professionals have access to, a whole other range of equipment designed for more complex situations. We can delve into that next.
I'm all ears. Let's dive into the world of professional emergency response.
The same source that talked about blizzard survival also gives us insights into what the pros use, from, supplies for trauma and bleeding control to defibrillators, airway management equipment, and even tools for patient handling and evacuation.
Okay, break it down for me. What exactly are we talking about here? What kinds of things do they use for trauma and bleeding control?
They have things like topical hemostats to stop bleeding quickly, tourniquets, specialized trauma dressings, chest seals for puncture wounds, and, comprehensive bleed control kits. It's all about stabilizing the patient and controlling blood loss in those critical moments.
Makes sense. Time is of the essence in those situations. And what about defibrillators? I know those are used for, heart attacks. What kinds of defibrillators do professionals use?
They rely on AEDs, or automated external defibrillators. These are incredibly sophisticated devices that can, analyze a patient's heart rhythm and deliver a shock if needed. And of course, they need electrodes, batteries, and CPR face shields to go with them.
It's amazing how technology has advanced to help save lives. But it's not just about the technology, right? It's also about having the skills and knowledge to use it effectively.
Exactly. Training is crucial. But let's not forget about another critical area: airway management.
Airway management. What exactly does that entail? I'm not familiar with that term.
It's all about making sure the patient can breathe properly. They use things like bag valve masks to provide ventilation, aspirators to clear obstructions, and laryngoscopes to visualize the airway. They also have supraglottic airway devices, oxygen masks and tubing, oxygen cylinders, and suction devices.
So it's about keeping the airway clear and ensuring the patient is getting enough oxygen. That's crucial. What other kinds of equipment do they use?
Well, they have a much wider range of first aid supplies than what we've discussed for personal kits. They need to be ready for anything. Think, more specialized wound dressings, bandages, tapes, splints, and other supplies that can handle a variety of injuries.
It makes sense. They never know what they're going to encounter. What about diagnostic equipment? Do they have tools to help them, assess the patient's condition?
Of course. They have stethoscopes, pulse oximeters, heart rate monitors, thermometers, blood pressure monitors, and even ECG machines to get a detailed look at the heart's activity.
Wow. It really is like having a mobile hospital at their disposal. I'm starting to grasp the scope of what they do. It's incredible.
It's definitely a demanding field, but also incredibly rewarding. They have the tools and the training to handle even the most challenging emergencies. But it's not just about treating the patient on the spot. What about getting them to safety?
That's a good point, especially in a disaster situation. Moving people can be a huge challenge. What do they use for that?
They have specialized equipment for patient handling and evacuation. Think stretchers, transfer boards, special chairs for evacuation, cervical collars to stabilize the neck, and splints for, fractures. They need to be able to move patients safely and efficiently, especially in chaotic situations.
They really are prepared for everything. It's reassuring to know that these professionals are out there ready to respond when we need them.
It is indeed. But let's not forget about another crucial aspect of their work: infection control.
Oh, right. Keeping things clean and sterile must be a top priority, especially in, an emergency situation. What do they use to ensure infection control?
They use antibacterial hand gels, biohazard cleanup equipment, disinfectants, personal protective equipment, or PPE, gloves, surface wipes. It's all about, minimizing the risk of infection for both the patient and the responders.
Makes sense. Infection control is critical in any medical setting, but even more so in an emergency where things can be chaotic.
Absolutely. And speaking of using your kit, what happens after you've used your emergency medical supplies? There are some important things to remember once the immediate crisis has passed.
That's a great question. I'm guessing replenishing your supplies is key.
Yeah.
What else should people keep in mind?
Our podcast source, Emergency Medical Kits, Your Life-Saving Ally, outlines some important steps. First, you need to document the incident.
Document. What do you mean by that?
Write down what happened, the injuries or illnesses you treated, what supplies you used, and the care you provided. This can be helpful for insurance purposes, for tracking what needs to be replaced, and even for reflecting on your response later.
So it's not just about the physical act of providing care, but also about the record keeping afterwards. Makes sense. What else is important?
Of course, replenishing any used supplies immediately so you're ready for the next emergency. And you need to sterilize any reusable tools like tweezers or scissors. Can't just throw them back in the kit without, cleaning them properly.
Hygiene is key, especially when you're dealing with potential infections.
Exactly. And finally, you should take some time to reflect on the event.
Reflect. What do you mean by that in this context?
It means thinking about what happened, how you handled it, and whether there's, anything you could improve upon next time. Maybe you realize you need additional training or equipment, or maybe you discover you were perfectly prepared and handled the situation, flawlessly. Either way, it's a valuable learning experience.
That's like a debriefing, right?
Yeah.
A chance to learn and grow from the experience. I love that. It's so much more than just having a box of bandages. It's about knowledge, skills, and even mental preparedness.
You're getting it. It's about a holistic approach to emergency preparedness. And I think we have a lot more to explore in that realm.
I'm ready. Bring on those expert insights.
What's fascinating to me is this common thread running through all these recommendations.
Maybe from those basic kits to the specialized ones used by pros.
Yeah, exactly. It's all about preparedness,
Yeah.
right? Anticipating those risks and having the tools and knowledge to respond effectively. It's not just about having the stuff. It's about knowing how to use it and being, mentally prepared to actually face a challenge.
So it's like a mental game too, not just, physical supplies.
Absolutely. Another important takeaway is that your kit should be tailored to your specific environment and needs.
Well, yeah, that makes perfect sense. A kit for a camping trip in the wilderness is going to look different from what, like a family in a city might need.
Precisely. You need to consider the potential hazards where you live and the activities you do. If you're in earthquake country, you'll need supplies for that. If you have allergies, those medications are non-negotiable.
So it's about customizing your kit to your own risk profile. What about training? We talked about how important it is to know how to use the supplies, but where do you even, start?
Basic first aid and CPR training are invaluable no matter who you are or where you live.
I know. I keep meaning to take a CPR class. It seems like one of those essential life skills.
You're absolutely right. Knowing CPR or basic first aid could literally save your own life, the life of a loved one, or even, a complete stranger. And it's not just about the skills themselves. It's about the confidence it gives you.
Yeah, that sense of empowerment, knowing you can, handle a situation. I can see how that's a crucial part of preparedness too. So we've covered a lot of ground here. What are some key takeaways for our listener? What do we really want them to remember?
First and foremost, everyone needs an emergency medical kit, no matter where you live or what you do. Even a basic kit can provide a sense of security and the ability to handle those unexpected situations.
And it doesn't have to be overwhelming. You don't need to go out and buy, everything at once.
Right. Start with the basics and gradually add items as needed. And remember, knowledge is just as important as supplies. Take a first aid course, get familiar with your kit, and even practice using the items. It might feel a little silly, but that, hands-on experience can make all the difference in a real emergency.
Practice makes perfect, as they say. So start small, learn the skills, and build up your preparedness over time. What else?
Think about your environment and individual needs. If you have kids, you'll need supplies for them. If you have allergies, make sure you have your medications. It's about personalizing your kit to your, circumstances.
And being ready for those specific situations like blizzards, or even thinking about those WHO kits for outbreaks.
Exactly. And don't forget, preparedness is an ongoing process. Check your kit regularly, replace expired items, and, stay informed about potential hazards in your area.
Stay informed, stay prepared, and don't panic.
Precisely. Being prepared helps reduce anxiety and gives you the confidence to face whatever comes your way. It's about taking control, not being controlled by fear.
Well, this deep dive has been incredibly informative. I'm feeling so much more prepared already.
I'm glad to hear it. Knowledge is power, and being prepared is truly empowering.
I couldn't agree more. So now for the big question. Do you have any final thought-provoking ideas for our listener? Something to, really make them think.
I do. We've explored all these physical aspects of preparedness: supplies, equipment, skills. But what about the mental and emotional side? How do you prepare yourself mentally and emotionally for a crisis? That's something I'd like you to, consider.
That is a thought-provoking question. We focus so much on the practicalities.
Yeah.
But how do you stay calm and focused when, everything's falling apart?
Yeah, it's a crucial aspect of preparedness that often gets overlooked. There are things you can do to prepare mentally and emotionally. One approach is to, visualize different emergency scenarios.
So like a mental rehearsal, playing out different situations in your head.
Exactly. Imagine yourself responding calmly and effectively. This can help reduce anxiety and, build confidence.
Makes sense. If you've already lived through it in your mind, you're less likely to freeze up in a real event.
Precisely. Another helpful strategy is building a support network.
You mean like friends, family, neighbors, people you can rely on?
Yes. Talk to your loved ones about, emergency plans, share knowledge, share resources. Make sure you have people you can turn to for help. Knowing you're not alone can make a huge difference in your ability to cope.
It's like building a community of preparedness.
Exactly. And don't underestimate the importance of self-care. Taking care of your physical and mental health is crucial for resilience in challenging times.
So getting enough sleep, eating well, exercise, managing stress, all those things we know we should be doing, but sometimes let slide.
Yeah, those things contribute to your overall well-being and your, ability to handle stress. And remember, it's okay to ask for help if you need it.
We don't have to go through this alone.
There are resources available, mental health professionals, support groups, even online communities. You can find guidance and support.
We've covered so much ground in this deep dive, from those essential supplies and a basic kit to the specialized equipment professionals use. We even ventured into the world of mental and emotional preparedness.
It's been a fascinating journey. I hope you're feeling empowered to take steps towards greater preparedness in your own life.
It certainly has for me. I'm starting to see emergency preparedness not just as a chore, but as a way to, empower myself and my loved ones to feel more confident and resilient no matter what life throws my way.
That's the perfect way to put it. Preparedness is about taking control, equipping yourself with the knowledge, skills, and resources to navigate challenges effectively.
It's about being proactive, not reactive, taking charge, not being caught off guard.
Exactly. So what does this all mean for you? It means you have the power to take action, to build your own lifeline, right? To create that safety net for yourself and your loved ones.
And it all starts with a single step. Maybe it's gathering those basic supplies, taking a first aid course, or even just, having that conversation with your family about what you would do in an emergency.
Every step towards preparedness is a step towards greater peace of mind.
Yeah, and that peace of mind is priceless. What else do we have in this deep dive?
One of the sources you shared, emergency medical kits, your life-saving ally, also had some really practical advice for what to do after you've actually USD your kit.
Oh, that's a great point. I never really thought about that. It's not just about having the kit. It's about what you do afterwards.
Exactly. They highlighted a few key things. First, document the incident.
Document. What do they mean by that?
Write down what happened, the injuries or illnesses you treated, what supplies you used, the care you provided, that sort of thing. It might seem like, overkill, but it can be helpful later on.
I guess for insurance purposes, or maybe just to keep track of what needs to be replaced in the kit.
Precisely. And speaking of replacing supplies, that's the second crucial step. Make sure you restock any items you used, right away. You don't want to find yourself in another emergency without those essentials.
Makes sense.
Anything else? Don't forget to sterilize any reusable tools like tweezers or scissors. Can't just, toss them back in the kit.
Oh, right. Hygiene, hygiene, hygiene.
Exactly. And lastly, they recommend taking some time to reflect on the event.
Reflect. What does that mean in this context?
It means, taking a step back and thinking about how you handled the situation. Was there anything you could have done better? Did you have all the supplies you needed? Was there anything that, surprised you?
So it's like a debriefing, right?
Yeah.
A chance to learn and grow from the experience.
Yeah.
I love that. It's really about continuous improvement, always striving to be, more prepared.
Exactly. And it's also about celebrating your successes. Maybe you handled the situation perfectly. It's always good to acknowledge what you did well and give yourself credit for being prepared.
Yeah, it's so easy to just focus on getting the supplies together, but reflecting on it, learning from it, that's a whole other level.
It really is. And it kind of brings us back to that whole idea of mental and emotional preparedness, right?
Right, because even with the best kit in the world, if you panic when something happens, it's not going to help much.
Exactly. That's why it's so important to develop those mental and emotional tools right alongside the physical ones. We talked about visualization and support networks. But there's another crucial element, I think, self-care.
That's a good point. It's hard to be resilient in a crisis if you're, already running on empty.
Exactly. Taking care of your physical and mental health, that's fundamental, getting enough sleep, eating well, exercising, managing that stress. These things all contribute to your ability to, cope with tough situations.
It's like building up your reserves so you're ready when you need them.
Precisely. And remember, asking for help is a sign of strength, not weakness. There's no shame in reaching out to, mental health professionals, support groups, or even those online communities if you need that support.
We're all in this together. And sometimes just talking to someone who gets it can make a huge difference.
Absolutely. So as we kind of wrap up this deep dive here, what are some key takeaways for you?
For me, it's been a real eye-opener, honestly. I used to think of emergency preparedness as just having a first aid kit tucked away somewhere, but now I see it as so much more. It's about knowledge, skills, mental strength, community, even self-care.
That's a great summary. It really is about taking this, holistic approach to being prepared for whatever comes your way.
Exactly. And it's empowering knowing you've got the tools and resources to, face things head on.
Preparedness isn't about living in fear. It's about taking that control, reducing that anxiety, and feeling confident in your ability to navigate those difficult situations.
It's about shifting from being reactive to being proactive.
Precisely. So, what's your next step?
Honestly,
Yeah.
I'm feeling inspired to actually take action. Maybe I'll finally sign up for that CPR class or have that conversation with my family about our emergency plan. Or maybe I'll just spend some time reflecting on my own mental and emotional preparedness.
Any step you take, no matter how small, it's a step in the right direction.
Right.
Remember, preparedness is a journey, not a destination.
Well, thanks for, guiding us through this deep dive. It's been incredibly insightful.
It's been my pleasure. Stay safe, stay prepared, and keep exploring.
And to all our listeners out there, remember, you have the power to create your own lifeline, to build that resilience and peace of mind. So take that first step today and embrace the journey of preparedness.